Let's start with the commonly replaced hormones.
The estrogens, and you have to look at all three of them: progesterone, testosterone, the metabolic hormones, which are thyroid, insulin, and cortisol. Insulin and cortisol actually go up, so you're not replacing them, but you're balancing them.
Okay.
Then you have DHEA, hormone of immunity, melatonin, known for its sleep effects, but really an anti-cancer hormone, pregnenolone, which is a hormone of memory and concentration, and growth hormone, which is the major hormone affecting connective tissue, muscle, fat, skin, bone.
How does somebody know if they have a thyroid problem? What are the symptoms?
Symptoms of thyroid: fatigue, depression, mid-abdominal weight gain, lack of mental clarity, brain fog type feeling, falling hair, dry skin, puffy eyes, plus minus. Sometimes people get swelling in the legs, swelling in the hands.
Have you had patients that on testing or on tests show low thyroid or whatever, and it's turned around immediately? Where these symptoms go away right away?
Within 4 to 5 weeks.
What about weight loss? I think of thyroid as this metabolic, I've always wanted thyroid, by the way.
It is a metabolic hormone, and interestingly enough, the hormones that I mentioned actually decline in everybody by age 50. So, for example, thyroid, no matter where you're testing, by age 50, you're at 50% function for thyroid.
So they would be candidates.
And they would be candidates.
What about those people? And I hear this all the time. It's happening to me right now. I can't lose weight the way I used to. Is thyroid plays a role there?
Thyroid does, and so does the entire model that I was telling you about.
So it's not just one hormone, obviously.
No, it's not just one hormone. The thyroid activates progesterone. It activates estradiol. The cortisol suppresses the thyroid.
Okay.
The cortisol, which is the stress hormone, also activates insulin resistance. So usually when people in their late 30s and 40s start to gain weight, we're talking about people who have insulin resistance. And everybody
Can that be turned around?
It absolutely can be turned around, but it needs to be turned around by focusing on all 5 areas.
Okay.
And what I have found is traditionally if you focus on one area, oh, I think I'll just take some chromium. You see these products on the shelf all the time.
Yeah.
Or maybe I should just take some thyroid. But if you don't have the selenium and the zinc, the thyroid won't work. So that's why it becomes so critical to look at all the pieces.
Okay.
And indeed, we have an outstanding mechanism of reversing metabolism in the form of a weight loss program.
In your practice?
Yes, and that's exactly what you do, is you
Putting it all
look at
together.
each component, right.
Okay, testosterone. Now, when I think of women, I don't think of them having testosterone levels. So how do I know?
Yes, again.
Okay.
Women do have testosterone levels, and I think it's one of the most ignored aspects. So many women have a decreased libido or decreased orgasm, completely have lost their desire for sex and their enjoyment of sex, even from the late 30s onwards, and this is completely reversible. Clearly something has happened. Any symptom we have in our life is a manifestation of imbalances. And those imbalances never lie in one area. It's never just testosterone. But testosterone is a huge component of it. It's never just stress. It's never just a nutrient deficiency.
Okay.
So again, paying attention to the entire model,
What are other...
you can correct these imbalances.
So besides libido, what else is testosterone responsible for?
Testosterone receptors, again, are in every organ of the body. The brain, the bone, the skin, the muscles. So low testosterone is related to low mental clarity, low energy, increased fat, especially in the middle abdomen, decreased muscle. And testosterone also activates all the rest of the hormones. All these hormones activate each other. So testosterone is an absolute ingredient of anybody who's looking to replace all of the hormones to physiological levels. That's one of them you have to look at. Obviously, you don't replace it if somebody has a good level. But in people who are low, an amazing difference. I have
Huge
patients
difference.
calling me and telling me they love me.
What do they say, by the way?
I love you.
Okay. Do they say things like, you gave me my life back?
You gave me
saved
my life back. I love you. I'm back. I've had women come in who have lost their ability to leave the house. They've lost their marriages. They've lost their ability to deal with their children. And they recognize it. They come in saying that I know that I'm snapping, at my family, and I know that I'm driving them away, but I don't know what's wrong with me.
Interesting. And it's part of a hormonal imbalance.
Hormonal imbalance.
Across the board.
Nutritional
and
imbalance.
So, I guess traditional medicine, without saying anything negative, are you implying that those type of symptoms would normally be taken care of with an antidepressant?
Very often.
Okay.
In fact, the recommended medication for what we call premenstrual syndrome is an antidepressant. That is absolutely what the recommended treatment is.
Do work.
And they do work. So the question that a woman has to ask herself is, am I Prozac deficient or am I progesterone deficient?
Okay.
You want to replace the
Interesting.
progesterone deficiency with Prozac and Xanax or with natural progesterone. Interestingly enough, Prozac and Xanax happen to bind to the same brain receptor in the brain that progesterone binds to, which is the
Have you
GABA
had
receptor.
people that you've weaned off these antidepressants?
100%.
All the time?
They wean themselves off it.
Really?
As soon as we get them balanced, they get off of their medication.
But do you see this all the time?
All the time.
Weekly?
And I see it all the time. In fact, the patients that remain in the practice on these medications, I question that.
Okay.
That's the rarity.
The process. Do they always see you on day one? And where does somebody start, I should say, as well?
If they're interested in the hormone replacement, they do see me. And we sit down and we go through their individual symptoms and really map out a plan for them on all 5 levels that I was talking to you about. We then order lab work based upon what they're interested in looking at and start to work step at a time with an exam, and then we start to replace the hormones one by one. Most of the patients who come to see us 2 to 3 times a year for balancing these 5 areas, and then they continue to go to their regular medical doctors for their regular medical care. They see us as sort of a place where they are optimizing their cell function and optimizing their capacity to not be on other medications and other drugs.
So your final message to anyone suffering with these symptoms?
With the knowledge that we're going to live longer than those before us, comes the quest, obviously, to live better than those before us. And we have to ask ourselves if we're going to be in a wheelchair, maybe not knowing our name, or if we're going to be walking, talking, happy, and energetic. And that quest is a choice.
Okay.
It's our choice.
All right. I want to thank you for coming on the show. Very, very good. You've been watching The Wellness Hour.